हेलो मेडिकोस। तो आज हम बात करेंगे सीजर्स के बारे में, जो कि हमारे एक इम्पोर्टेंट शॉक टॉपिक है एंड पीडियाट्रिक्स वर्ल्ड में केस प्रेजेंटेशन भी होती है। बाय डेफिनेशन सीजर्स आर द एबनॉर्मल paroxysmal electrical activity of our brain which can be manifest in the four manners: motor, sensory, behavioral changes followed by ANS disturbances. Generally, mother came to the world with the complaints of the uprolling of the eyes of the baby followed by abnormal limb movements. It can be in the form of flexion or extension, and it can also be associated with bowel and bladder incontinence because of the ANS disturbances. There are two type of causes: provoked and the unprovoked. Provoked factors are like fever or any other acute illness that is promoting our seizures or abnormal movement, and second one is unprovoked, that is the underlying any brain injury or any brain dysfunction. Coming to the topic febrile seizure. Febrile seizures are the seizures that are provoked by fever. Along with, there should not be any CNS dysfunction or no previous unprovoked seizure. Sometimes what happen, like teacher used to ask what is febrile seizure, and our answer seizures that is followed by fever. But that is the just meaning of this. These 2 points have to be included so that it can be correct definition. There should not be any CNS infection and no previous unprovoked seizure should be there. Febrile seizures are of two types: typical one and atypical. Typical also known as simple, and atypical also known as complex and the complicated. Typical generally manifest as a generalized tonic-clonic seizure. Generalized tonic-clonic seizures, and that is more common than that of the atypical one, and having the one episode during fever. Only one episode will be there. Here multiple episode, duration less than 15 minutes. Here duration will be more than 15 minutes. So, and typical one are more common in children's. Okay. Then I'm talking about the recurrence. Mother can ask like, is there any chances that my baby can have seizures episode in future again? So recurrence is up to the 5 years is there, and incidence from the 6 months to 5 years is there. But if recurrence is greater than or equal to 5 years, that is known as epilepsy. Now talking about the risk factor. Risk factors are: if baby age is of less than 1 year of age, then duration of fever is less than 24 hours, and fever is ranging between the 38 degrees Celsius to 39 degrees Celsius. These are our major risk factors. Now talking about the some minor risk factors like family history. In febrile seizure, generally family history is there of fever, or mother can also have that febrile seizures in her childhood. Then complex febrile seizures, or also known as atypical febrile seizures, male genders. These are generally common in male genders. Okay. Then hyponatremia, because electrolyte imbalance is the cause of seizures. Electrolyte imbalance during fever is the main cause of seizures. Now talking about the investigations. Investigations are EEG and MRI, but these generally in the high risk cases. Generally seizures is clinical diagnosis. So but if something is there, like risk factors are there, then we can go for EEG or MRI. Lumbar puncture is suggested to rule out a CNS infection. For example, if baby is having some meningeal sign like neck stiffness is there, or Brudzinski sign or Kernig sign is positive, then we can go for lumbar puncture to rule out any CNS infection. Then recent antibiotic course, because antibiotics can mask the symptoms of seizures. That's why lumbar puncture is required in recent antibiotic course. And unimmunized child, or child have taken the immunization but that is not up to date, like 1-year-old child is there, I have taken only 6th week immunization, that is incomplete immunization. So that, then also we have to go for lumbar puncture. Now talking about management is lateral position, safe surrounding, suction and the oxygen therapy. This is our basic to suction and oxygen therapy to prevent the aspiration, and safe surroundings so that baby can't harm himself by the surrounding any material. Okay. Then control of fever. For this, antipyretics, Pmol and paracetamol and tablet sponging we have to use. Then control of seizures, drug of choice is benzodiazepines, that should be IV. If IV is not accessible, then per rectal diazepam and intranasal midazolam can be used. And newborn seizures, drug of choice is IV midazolam. Like after the birth, if baby is having any illness, fever and all, and during the ICU admission he or she can get seizures, then our drug of choice is midazolam. We can't go for lorazepam, diazepam and all. And prophylaxis is drug of choice in India is clobazam, that is oral. Okay, so please follow. Thank you.